Mental disorders are sparse in ASEAN. Routine screening is rare. The number of population-level survey is also very limited. High levels of stigma, low awareness, and reluctance to recognize these conditions further hinder accurate data collection. We attempted to overcome these data gaps with extensive data and literature search, and by applying rigorous modeling techniques. Despite these challenges, we believe it is important to present the best results currently available, to raise awareness of mental disorders, to stimulate debate, and to encourage improved surveillance. Mental disorder pose a growing public health crisis in many countries, and inaction carries a high cost. It is very important to use best available results to inform policy change in this area. We studied 10 mental disorder conditions, including depressive disorders, anxiety disorders, bipolar disorders, schizophrenia, autism spectrum disorder, conduct disorder, attention deficit hyperactivity disorder, eating disorders, idiopathic developmental intellectual disability, and the general categories of all other mental disorders. Our study found that in 2021, there were an estimated 80.4 million cases of mental disorders in the ASEAN region, representing a 70% increase since 1990. The greatest burden were observed among adolescents, and a growing number of cases also seen in older adults. Map A shows the age-standardized prevalence across the 10 ASEAN countries. Country variation is small. Prevalence ranged from 10% in Vietnam to 13% in Malaysia. Map B shows the age-standardized disability-adjusted life year daily rate for mental disorder across the 10 ASEAN countries. DALY reflects health loss due to disability caused by a condition. Malaysia had the highest rate with an estimated 1,800 DALYs per 100,000 people, followed by the Philippines with an estimate of 1,700 per 100,000. This indicates that overall, people in Malaysia experience the greatest health loss due to mental disorder among ASEAN countries. Figure 2 shows the relative contribution of different mental disorder with respect to the total disease burden. Each color represents a specific mental disorder condition, and the y-axis here refers to percent out of total DALYs caused by the specific mental disorder. The graphs show that in general, anxiety disorder and depressive disorder accounted for the largest share of mental disorder burden. This figure illustrates the age and sex variation across mental disorders. Each color represents a specific mental disorder, with the y-axis indicating age group and the x-axis indicating DALY count. The width of each bar reflects the burden of a particular condition within an age group. Among females, anxiety disorder, represented in darker red, account for the largest share of disease burden. And across age group, the burden of mental disorder begin to rise around the age of 10 to 14 and continue to contribute significantly throughout adolescence and adulthood. Addressing mental disorders in ASEAN requires a multifaceted approach. First, improving awareness and changing the perception of mental health is crucial. While recent efforts in several ASEAN countries have increased public awareness and encouraged health-seeking behavior, studies have shown that mental disorder remain frequently undiagnosed and untreated. Second, special attention should be given to adolescents' mental health. Beyond commonly discussed stressors like social media, fundamental social and environmental factors such as low education attainment, poverty, food insecurity in low and middle-income ASEAN countries still significantly impact mental health. Improving mental health will require tackling these broader determinants. Finally, mental health issues have not been sufficiently addressed in current healthy aging strategies. With an aging population, it is important to ensure the integration of mental health into geriatric care and services.